Hello, my name is Tommie Johnson. My social change portfolio addresses the seriousness of homelessness situation in the state of Michigan, specifically Grand Rapids, Michigan. The social change actions have been backed by the rising cases of the problem in the last few years. Data and statistics have shown the problem is more prevalent among the vulnerable social groups, including college students. The worrying rise of these cases forms an integral part of my portfolio, aimed at coming up with the scientific and evidence-based intervention strategies to prevent the manage the problem. Scope and consequences. Michigan homelessness scope is a reflection of the state demographic structure made up of different culture, age groups, and communities. One key data ranks it as the sixth in the state, with the highest number of homelessness students in the country. Just like in other states, most homeless individuals in Michigan are families from low working class group. The social situation can have adverse consequences to individuals affected and communities involved. Among the most serious effects of homelessness are physical and health damages. It can have the affected as multiple researchers suggest. The homelessness are more vulnerable to mental health and physical and sexual assault cases. Social change and ecological model. The social ecological model is applicable in the homeless context for its use in uncovering the relationship between individuals, natural setup, and their risk for being homeless. By integrating this model, homelessness can be prevented through the incorporation of preventative measures at individual, community, and cultural level. Theories of prevention. My social change strategy is highly influenced by early interventions theory. The theory is adamant on using practical models such as statistical screening model, useful in supporting people that are more likely to be homeless. Through collaboration with other key community bodies and organizations, the program can easily predict individuals at high risk and intervene accordingly. Diversity and ethical considerations. The success of any social work program is closely related to its cultural relevance. In the subject of social change program, there is a need to come up with culturally sensitive initiative addressing community problem in the whole. To come up with a diverse program, there is a need to consult the community stakeholders in coming up with activities that are relevant to the subject community and beyond. Coming up with a diverse plan, program success is dependent on the strategies put in place to deal with the ethical questions and dilemma. The strategy should be informed by ethical considerations such as the client's privacy, discretion, confidentiality, and informed consent. Advocacy. All social training programs are aimed at pushing formulation of public policies to deal with social issues, considering the seriousness of the nature of homelessness. The advocacy and awareness strategies must tactically be designed. They must be designed differently for every level. At the community level, the program will come up with the sub-programs such as health checkups, raising attention to the community level. The institutional level advocacy will be supported through strategic partnership and collaboration with related organizations. The public level advocacy will be on a slightly higher scale, thus the need of aggressive advocacy approaches such as raising awareness through mainstream media.